As a midwife, a baby's health and well-being is one of your main priorities. When a baby's crying or restless, it can be difficult to know exactly what's wrong, and it's natural for new mums to feel worried and concerned. Of course, crying is a baby's first means of communicating, and normally you can reassure mums that there's nothing wrong other than a wet nappy or a bit of wind. However, if a baby's crying is a result of pain or fever, you can feel confident in recommending Calpol Infant Suspension. Trusted by healthcare professionals and parents alike, Calpol's gentle formulation is the only paediatric analgesic that can be given to babies from just 2 months and upwards for general pain and fever relief. Calpol, the trusted choice. Veale Clarke is one of Britain's best-known and experienced midwives. She's written Instinctive Birthing, an inspirational book which aims to help all women achieve the births they want. As this is generally a birth that proceeds as naturally as possible, her main task is to help women rediscover the instincts that can guarantee a happy pregnancy and a successful delivery, whether this is at home or in hospital. Veale Clarke's lifetime of working with pregnant women has given her the experience to help women recognise and listen to this wise counsel.
My future plans are continuing to be a midwife for as long as I'm healthy and able to practice as a midwife, and also to continue supporting mothers in informed choice for their births. In my experience, most mothers have heard of Calpol, very definitely. Whether or not they've had a baby, they've heard about Calpol. I think it's one of the tried and tested and probably trusted methods of analgesia for small children. Personally, I gave my children Calpol, and so therefore I heard about it. I also learned just the other day that my daughter-in-law, whose little boy, Aaron, he's 5 months old now, has actually had Calpol given to him for his teething with good effect. Children react well to it and enjoy the flavour of it.
Well, this year it's Calpol Infant Suspension's 40th birthday, which is just fantastic. That's 40 years of treating pain and fever in babies and children, and we're still going strong. And the other exciting news this year is that we found out we've been voted the best healthcare product for the 7th year running by mums. And I think the fact that it's by mums is particularly important to us because they're our customers, they're the people who really, really count, and it's a great accolade. I think this really demonstrates the trust that mums have in Calpol, probably because many of them were given to it when they were little by their mums, so they remember what it tasted like, they remember how it works, and taste is particularly important because it's got a great flavour, so mums can feel really confident that their babies aren't going to spit it out and they're going to get just the right dose that they need. A lot of mums talk to us about their experience with Calpol, which is great to get that feedback. And the thing that we get time and time again is that they really do have confidence in Calpol. They really feel very reassured that when they do give their baby Calpol, they know it's going to help them to soothe away pain or fever or what they're feeling at the time. I think now Calpol's become synonymous with babies and children and treating pain and fever, and mums really do feel very, very reassured that it's very, very gentle. I think particularly now because we can be given to a baby from 2 months of age, and at that age they're still so young and so vulnerable, so it's great to know that Calpol Infant Suspension can be used. I think another reason why mums feel very confident in giving their babies Calpol is that it is routinely recommended to them by healthcare professionals such as their midwife or their health visitor, so they feel very reassured. And we do a lot of work with healthcare professionals. We really recognise them, and particularly midwives as well, as being a very important source of information and advice for parents and first-time mums out there. We really hope that by supporting midwives, we're helping to make it even easier for you to give your parents and your patients the right level of information and advice that they need. The makers of Calpol understand what it's like to have children, and that's why, for 40 years, midwives and parents have trusted Calpol to help.
When you have your first baby, everything's very stressful, everything's for the first time, and they change on an almost daily basis, so you're just trying to keep up with them. Calpol has been a total godsend to me. I first used it for Anna when she had her immunisation at 2 months old, and she seemed so little and vulnerable at that time, but my health visitor had recommended it and it worked like a treat for her. She's teething at the moment, so I've got a good supply of Calpol in, and she likes the taste of it, so it makes it very easy for her to take the right dose, and she doesn't spit it out, unlike some of her baby food when I've been weaning her. Anna's 15 months old now, and I'm much more relaxed about her. We know each other, I know her routines, but it's great to know I've got Calpol there, so if she's teething, if she's running a fever, if she's got a cold, I've got something that's going to make her feel better.
The makers of Calpol understand what it's like to have children, and that's why, for 40 years, midwives and parents have trusted Calpol to help. For further information on Calpol, visit www.calpol.co.uk.